All right, so we've done, from a ball and socket standpoint, we've done posterior translation. Now we're going to do lateral distraction. Okay, so just straight away from the glenoid fossa. All right, so we have a couple options for this. This one, typically people will get more nervy, and so having a towel or something to act as a buffer is definitely helpful. The negative to that is it's harder to get all the way up to closer to that joint line when you have the towel, and you'll kind of see what I'm talking about. So it just won't be as good of a fulcrum point. So if people don't need this, don't use it because it's not as good. I'm going to show you with the towel though, because just for the sake of time. So go ahead and put that arm back down, Juliana. So I'm going to get that towel kind of up as far as I can in the armpit, and then I'm going to try to bring the belt all the way up towards the top of that. So with the belt on this one, ideally keeping your buckle kind of to the side here so that you can adjust it longer or shorter. Now, a big key for this is if I put this belt on her, it's going to be on this weird kind of angle. So I actually want to twist the belt to where the loop is up and down, so that whenever I have this on her arm and I weight shift back, I will get a good lateral distraction. Okay, so that's kind of a fun fact here is you want to actually rotate that so that you have a basically straight up and down or vertical circle there. Now I'm going to put that through her arm. Again, all the way up as high as I can get it. The foam roll is still supporting the elbow in this technique. The belt is looped around my pelvis. I don't want it to be looped around my lower back. Pelvis is much more stable. Okay. And then from here, I want to make sure I keep that humeral head in a neutral position. All right. And then I want her to, so I'm weight shifting back to decompress that humeral head. I can also just feel right here, as I weight shift back, I can feel how the head wants to distract away from the glenoid fossa. Okay. And then I can mobilize that through her doing abduction. So she can press out with her elbow. Good. And that like suctions it back in. And then as she slowly lets that go, you may even be able to see, go ahead and let that go. Whoop, how it slides out here. Right. So she really doesn't need this mobilization. This is more for people that are really compressed in the socket. But just so you know, like, I have, when I'm assessing for this motion, you want to assess and see, does it have the ability to distract out? It does, and then go ahead and push out there, and then that kind of suctions it back in. But some people just need to use that abduction to further mobilize to then get it to decompress. But once it's decompressed, I can have Juliana bring her other hand over here. And actually, I'm not going to show it like this. That's more for the home exercise. So if I bring her out here and I come into this little bit of space between the coracoid, basically between the coracoid process and well, really just on the front of that joint line, then I can have her push out with her elbow and she can feel how that suctions in there, right? And let it go. And then I want to try and teach her how to get that to suction in without abducting or without using her deltoid. I want her to suction that in with her rotator cuff itself. Okay, so I would let her feel a few times what it feels like to use her deltoid to suction in, and then I would have her bring her hand over to that space and see, can she suction that in without pressing out into her elbow, and let it go. Good, and suction in. And I can actually feel that she's doing that through the belt. That's a nice little trick as the therapist. Because my hand's not there, I can't actually feel it. And let it go. But I can feel how she's actually suctioning that in. Good. Okay, and it's hard for a lot of people to figure out. And one of the cues that really tends to help people the most is just imagining that the ball is decompressed and you really want to create this suction cup that's pulling that ball back into the socket. okay? And generally, if there is an intact rotator cuff, people can kind of figure that out. But it takes some time and it takes some frustration sometimes for people to not want to use their middle deltoid to do that. So that is lateral distraction or decompression of the glenohumeral joint.